I adjusted the open sign in my tiny pharmacy window, watching my parents' Mercedes pull into the modest parking lot. Their annual visit to check on their struggling daughter always came with the same pitying looks and thinly veiled suggestions about selling the business. Mom's designer heels clicked across the linoleum floor I'd deliberately kept from my grandfather's days. "Darling, this place looks exactly the same." Her tone suggested that wasn't a compliment. "Still running this little shop yourself?" Dad asked, his CEO confidence filling my carefully modest space. "You know, Peterson Pharmaceuticals is always looking for corporate pharmacists. Benefits, stock options." I checked my encrypted phone. 8 minutes until the market opened. "One tiny drugstore," Dad scoffed, picking up a generic aspirin bottle. "Your MBA was meant for bigger things. We didn't send you to Harvard for this." If only they knew that the outdated computer behind my counter was actually a terminal connected to my global operations center. That the storage room housed servers monitoring pharmaceutical production across 4 continents. That their failing daughter had spent 5 years building something they couldn't even imagine. "Speaking of Harvard," Mom sighed, "your brother's making partner at Goldman. He could help you invest the sale money when you finally close this place." My secure phone buzzed. "Market opens in 2 minutes. All positions confirmed." "You should at least modernize." Dad gestured at the vintage pharmacy shelves. "This looks like something from your grandfather's era." "Grandfather taught me everything I needed to know," I replied, watching the clock. "About patience. About looking beneath the surface. About building something lasting." The old TV in the corner, deliberately kept for this moment, flickered with breaking news. "Major pharmaceutical merger. Unknown CEO acquires industry giant." Dad's criticism faltered mid-sentence. Mom's perfectly manicured hand froze on her designer purse. My phone lit up. "Board meeting in 10, Madam CEO. Private jet standing by." "That merger," Dad whispered, recognition dawning as he read the ticker. "That's Peterson Pharmaceuticals. They're being bought out by Harrison Global Holdings." I finished, finally dropping the modest pharmacist act. "My company. That little drugstore, you mocked? It's the public face of the largest pharmaceutical empire you've never heard of." The TV continued its breaking coverage. "In a shocking move, Harrison Global Holdings, a previously unknown entity, has acquired pharmaceutical giant Peterson Corp in a $68 billion deal. Industry experts scrambling to identify the mysterious CEO behind." "That's impossible," Dad stuttered, his own corporate expertise failing him. "Peterson is too big. Their market cap alone." My outdated computer pinged. The hidden screen showed real-time stock positions, global manufacturing facilities, and a network of pharmaceutical research labs stretching from Boston to Singapore. "Ms. Harrison," my assistant's voice came through the hidden earpiece, "the board of directors is assembled. Tokyo and London offices standing by. And the FDA commissioner needs to discuss the new cancer drug approval." Mom sank into a vintage pharmacy chair, her Chanel suit against the worn leather creating a perfect picture of worlds colliding. "Cancer drug? The one Peterson's been trying to develop for a decade?" I smiled, pressing my palm against a hidden scanner. The storage room door clicked open, revealing a state-of-the-art command center. "We solved it 6 months ago. Along with treatments for 3 other incurable diseases." Screens lined the walls, showing pharmaceutical plants, research facilities, and distribution networks that made Peterson look like, well, a tiny drugstore. Each monitor displayed another piece of my empire, all hidden behind this modest facade. "But the startup costs," Dad protested weakly, his CEO brain trying to calculate impossible numbers. "The research facilities alone would require billions. Remember when Grandfather left me his worthless pharmaceutical patents?" I typed a command, bringing up archived documents. Turns out he wasn't just a small-town pharmacist. Those old formulas? They're the foundation of modern cancer treatment. The TV anchors were getting frantic. Harrison Global Holdings also announces breakthrough treatments for multiple sclerosis, Alzheimer's, and rare genetic disorders. Stock markets worldwide responding to your brother's Goldman partnership, Mom whispered. "He's been trying to identify the mystery pharma company buying up research facilities." "I know," I replied, checking another screen. "His firm tried to block my Taiwan acquisition last month. Cost them quite a bit of money, didn't it? My phone chimed again. Air Force One requesting secure line. President wants to discuss national medical stockpile. Dad's hand trembled as he reached for his own phone, probably trying to access his stock portfolio. Peterson's shares, they're soaring. The whole market is. Side effect of curing the incurable, I noted, entering commands that would reshape the pharmaceutical industry. Turns out grandfather's old-fashioned approach to medicine had merit. While Peterson chased profits, we chased cures. The hidden elevator hummed to life. Your helicopter is ready on the roof, ma'am. The board's waiting. You should join me, I told my shell-shocked parents. See what your struggling daughter actually built. Unless you'd rather stay here and count generic aspirin bottles. The private helicopter lifted off from my tiny drugstore's hidden rooftop pad, giving my parents their first aerial view of what I'd actually built. The modest pharmacy was just the tip of a massive research complex, most of it buried underground. State-of-the-art laboratories stretched for acres beneath the surface, hidden from prying eyes by what everyone thought was an empty lot. Latest acquisition numbers, ma'am. My CFO's voice came through the helicopter's secure comm system. Peterson's board just realized we also control their offshore subsidiaries. They're unsettled. Dad's face, already pale, went almost white. Offshore subsidiaries? But those are hidden through shell companies. Which I started buying 5 years ago, I replied, watching global markets react on my tablet. While you were mocking my little pharmacy, I was building a pharmaceutical empire piece by piece. Amazing what people don't notice when they're too busy looking down on you. The helicopter banked, revealing more of my hidden infrastructure. Underground tunnels connected to private shipping lanes, automated manufacturing facilities disguised as warehouses, and a private airstrip handling cargo planes filled with life-saving medications. Your quarterly profit projections, ma'am, my assistant forwarded to my tablet. We've exceeded Peterson's annual revenue in the past 3 weeks. Mom's perfectly manicured hands clutched her designer purse. 3 weeks. But Peterson is the largest. Was the largest, I corrected, signing digital authorizations for more acquisitions. Currently, Harrison Global Holdings produces 60% of the world's critical medications. Peterson was just the public face of the industry. The real power was always hidden. My tablet chimed with urgent messages. Asterisk, who emergency meeting requested. Asterisk, Gates Foundation seeking partnership. Asterisk, Chinese Pharmaceutical Authority in crisis session. Asterisk, Wall Street Journal. Mystery so revolutionizes global health care. Ms. Harrison, my head of security radioed, the FDA Commissioner and EU Health Committee are waiting in the main conference room. And sir, he addressed my father, your company's board is trying to reach you. Something about a complete market reorganization. Dad fumbled for his phone, suddenly remembering he was CEO of a now minor pharmaceutical company. My board, they'll want to know. That your daughter just became their boss? I smiled, watching his corporate confidence crumble. Don't worry. I'm keeping their jobs. For now. The helicopter approached our real headquarters, a gleaming tower of glass and steel, its true purpose hidden behind mundane corporate branding. Below, news vans were already gathering, trying to solve the mystery of the unknown CEO who just reshaped global healthcare. That cancer drug Mom mentioned? I pulled up the research data. We're releasing it at 10% of Peterson's plan price. Affordable healthcare tends to upset the market. Speaking of which, the helicopter landed on the tower's private helipad, where Dr. Sarah Chin, my chief of research, and the brilliant mind Peterson had once rejected waited with a team of executives. The cancer drug trials, she announced, holding up her tablet. 100% efficacy rate. The FDA's fast-tracking approval as we speak. Mom's hand flew to her mouth. 100%? When you're not cutting corners for profit, I explained, leading them into my real office, amazing things happen. Show them the cost analysis, Sarah. Dr. Chin projected a holographic display. Production cost, $3 per dose. Peterson's plan price was $120,000 per treatment. Our price? $1,200. You'll bankrupt the company. Dad exclaimed, his CEO instincts kicking in. Actually, I pulled up our financials. We'll make more money than Peterson ever did. Volume over margins, Dad. Basic business principle you taught me, remember? We'll treat 1,000,000 patients instead of a few thousand. The wall of screens in my office showed our global operation in real time. Factories ramping up production, research labs processing data, hospitals worldwide preparing for a healthcare revolution. Your brother's been trying to buy our stock all morning, my CFO mentioned, entering with more reports. Along with every major hedge fund in Manhattan. Not for sale, I replied, watching Dad wince at the missed opportunity. This isn't about quick profits. Grandfather understood that. A familiar face appeared on the main screen. The Peterson CEO who'd rejected my job application years ago. The board is ready for you, Ms. Harrison. Perfect timing, I smiled, gesturing to my parents. You remember Mr. Peterson? He's about to explain to his shareholders why being the biggest didn't help them see what was coming. Mom's social instincts finally kicked in. All those charity galas, those pharmaceutical conferences, where you sat quietly in the corner. Gathering intelligence, making connections, building alliances. I checked another screen showing global market reactions. Amazing what people reveal when they think you're just a small-town pharmacist. The elevator chimed and my inner circle of executives entered, each headhunted from companies that had underestimated them. Scientists, strategists, and visionaries who'd been dismissed by the old guard. The WHO's secretary is on line 1, my assistant announced. The EU Health Commissioner on line 2. And, your brother's investment firm is attempting another hostile takeover. Put the WHO through to the conference room, I instructed. Tell the EU we'll meet in an hour. And remind my brother that hostile takeovers only work if the target company's shares are public. Dad's phone buzzed, probably his board demanding answers. Mom's social calendar notifications kept pinging as her pharmaceutical society friends tried to figure out their new reality. Shall we? I gestured toward the conference room. The Peterson board is waiting to meet their new owner. Unless you'd rather go back to counting pills in my little pharmacy?